coronavirus or COVID-19.
Thank you very much, Stephen. Good evening, ladies and gentlemen, my colleagues on both sides, CMO, PS, Dr. Ennis, others in the room, and those listening on. This is an unusual COVID conversation. I know that you are accustomed to a Thursday evening session, and we're keeping to that. However, we thought it was necessary to give an update in light of one particular aspect which requires some immediate pronouncement on, and also to offer an opportunity for any questions, clarifications. So while a release could have been done, we felt that the technical team would probably be necessary just in case there are any questions, and in keeping with our transparent approach. So beginning, and I'm speaking now, starting off on the availability of vaccines, and in particular the Pfizer brand. Beginning tomorrow, September 15th, 2021, the administration of the Pfizer vaccine will be postponed until a second shipment arrives from the United States. And this is expected to happen within the next 2 to 3 weeks. We are now near completion of the administration of the more than 200,000 doses of the Pfizer vaccine that were shipped to Jamaica from the United States last month. Up to 12 noon today, some 179,915 doses of the Pfizer had been administered. Of that number, some 143,039 were first doses, and 36,876 were second doses. The expectation is that by tomorrow, by end of day today, we would have used up the just over 28,000 remaining doses. As a consequence, this announcement is in anticipation of that. Once the new shipment arrives, persons now due or who will be due their second dose will be given the jab. Over the next 3 weeks, some 82,545 persons will be due their second dose, and we want to use the opportunity to assure persons that they will get their second dose once supplies arrive in the country. The World Health Organization recommendations on the administration of the Pfizer second doses gives consideration to the second dose being given within 3 to 6 weeks after the first dose, and up to 12 weeks in some instances. And we will therefore delay the second dose, and we are anticipating somewhere around 6 weeks. So it's important to make this statement because we know that persons are asking. We know that persons would have now reached their 3-week period, which is what was advocated in the prior to the Pfizer being administered. We did expect to get a second shipment based on the agreements we had with the U.S. and anticipated that shipment arriving in time to administer second dose. Having said that, those discussions are taking place. We have not yet been given a firm date, and so we wanted to make this announcement, but also to provide the technical guidance and to reassure the public that there is some time remaining that one can wait to get the second dose and to ensure its effectiveness. The CMO and Dr. Ennis are here, so they can comment further after I've completed the process and if you have questions on that. But certainly we are projecting within a 6-week period for those 82,000 plus to get their second dose, and then hopefully to continue to administer first dosage. In terms of the ongoing vaccination, the ministry is continuing to administer the other 2 vaccines that are available, and there is sufficient numbers there. That is the AstraZeneca and the single-dose vaccine, Johnson & Johnson. Members of the public are encouraged to, of course, get vaccinated, and I must say that we have seen an uptick in the numbers coming out at the locations, and that is a very encouraging sign, and we want to continue to encourage that. The AstraZeneca and Johnson & Johnson we have in stock, and indeed we want to recognize the arrival of additional stocks only last evening, where both AstraZeneca and Johnson & Johnson were received quantities 108,000 doses respectively. So that's over 200,000 doses of the 2 brands combined. The doses are part of the purchase arrangements through the COVAX facility in the instance of the AstraZeneca, and Johnson & Johnson purchased from the African Medical Supply Platform. So again, we received a shipment last evening of those 2 brands, and we want to urge the public. The cardinal rule of vaccine take-up is to take the one that is available, as long as you fit within the criteria, in this case 18 years and over, for those 2 brands that we have. Do not wait. Be careful and be cautious about waiting on a brand because of any personal preference. All the vaccines have met the clinical requirements, the expert sign-off, and therefore all offer protection, and waiting could actually impact your vulnerability in terms of the virus, particularly now in this stage of a 3rd wave. So we do encourage persons to take up the vaccines that are available, and those who have to wait to hold on until we get the second dose of the Pfizer. Up to 4:30 p.m. today, that is September 14th, 2021, a total of 686,828 doses of the COVID-19 vaccine have been administered. And that's encouraging, because that represents some 98% of the 700,000 doses that we had projected, the Ministry of Health and Wellness, for the month of September, and we're only halfway in the month of September. So I really want to commend the team. I know it has been very challenging in the field, given the bottlenecks around locations, the limitation of vaccine administrators, nurses, doctors in the public space, with the support of the private sector in many instances. But it is paying off in that we are meeting the target that we had set, and will surpass that target, given that we're at the middle of the month of September. I suspect by tomorrow we would have achieved the 700,000 doses. So I really want to just thank the Jamaican people for being responsive, for their patience, and thank those who have been working so hard in the field non-stop to achieve this objective. Of that number, some 478,660 were first doses, 191,009 were second doses, and 17,160 would have been the single dose Johnson & Johnson. I have to pause to also encourage persons to take up the Johnson & Johnson. It is a single dose, that's a benefit, offers the same level of support and protection, and over time we will be spending some time to encourage and to demonstrate the importance of taking that particular brand, because we believe it certainly will make the process easier while offering the same protection. To become vaccinated, of course, members of the public are encouraged to visit a vaccination site close to them. Details on the site can be found at the vaccination.moh.gov.jm website. I want to also remind members of the public that the ministry is moving to expand our vaccination access points. As such, we have, as I had indicated at the last COVID conversation, issued an invitation through a request for quotation, a RFQ, to the private sector for their participation in the vaccination program. RFQ really means a proposal from them to say how they can administer the vaccine within certain guidelines that is provided and what it would cost to do so. And that has been opened. The RFQ is on the website. And in the first instance, I believe the due date is tomorrow at 11 a.m. for those proposals to be opened and assessed. And we are getting some proposals in, so that's a positive thing. We will consider whether or not we will expand it depending on what we assess. But so far, we're encouraged in terms of the proposals we're receiving. The RFQ is aimed at including small, medium, and large enterprises that may be faith-based community, faith-based, so the church, if you can get the clinicians and the setup and the protocols, community-based or existing healthcare facilities, such as pharmacies, hospitals, health centers, or even doctors' offices. Once you meet the criteria, then we assess, and we will provide an appropriate response for you to set up a vaccine site. The initiative will, as a clear objective, seek to expand the access points for different clients who will be able to receive their vaccination while shopping or visiting their doctor's offices. And we welcome all private sector organizations, faith-based organizations, and community-based organizations to go to the ministry's website, download a document. It's not a very difficult document to maneuver. There are a number of pages, but the section that is requiring of your proposal is there and clear to understand. And we look forward to as many entities participating. To simplify, how it works is that once you are selected, it means you would have given a price to administer the vaccine. You would have a location or a facility that could be mobile to go into locations. You would have met the protocols around the clinical guidelines, and you would have a price that the government would pay to administer the vaccine. The vaccines are free, to be very clear. The government is paying for the administration of the vaccine, and the person who is receiving the vaccine is not paying anything. Very, very clear. It is the provider who is providing it, with the oversight, of course, of the Ministry of Health and Wellness. We believe that the idea for this time has come, given the consistent supply of vaccines, and we think it will open up more avenues, more channels, and hopefully over time reduce the crowding out in some locations. I should mention too that I've asked the Permanent Secretary and his team to pull the private hospitals from the RFQ of other entities, given their greater levels of preparedness, given that they are a hospital, they have beds, they have doctors, nurses, other forms of equipment and infrastructure in their normal course of activity. And let us get them going as quickly as possible, perhaps as early as next week, once they have responded. I did have a meeting with them, was it 2 weeks ago, I think, and we went through about 10 of them. We went through the process. Many of them have responded and have expressed an interest. And in the interest of time and the speed and the efficiency in which we seek to administer vaccines, we're going to be pulling them out and trying to have an agreement with them as quickly as possible, perhaps as soon as next week. And we will keep the public informed on that as we expand outlets for the vaccine take-up. In terms of pop-up vaccination outlets, that's another avenue that we're working on. This past weekend, in addition to our Blitz activities, we also did a couple of pop-up vaccinations, which were indicative of the success that we can have through partnership with private sector stakeholders and other interests. So we rolled out the mobile bus in Kingston, the Fontana Pharmacy Waterloo location on Saturday, and we vaccinated some 207 persons, many of whom came to do their shopping. Others came directly to get vaccinated. But it was a good partnership. It went well. This one was really a pilot to see how the mobile unit would work. And I think it worked well. And we have at least one other that is fully prepared and a few others that we're working on. We also did, as a collaborative effort with the ministry, a Megamart location on Sunday, and that went very well. We did 960 persons, and we want to recognize the Family Health Unit and the team from Mona Aging and Wellness Center for managing or activating that site. So we still used our own internal folks, but it was in collaboration with a private sector entity. And as you can see, it worked well. So I want to recognize those two entities. There are several other initiatives that are taking place. CariMed did. I know Jamaica Broilers has done, I think, Caribbean Broilers and a number of other companies. This week, last week, late, we had a briefing with the trade union, Joint Confederation of Trade Union, which is the trade union body, and they are now planning a few blitz of their own in entities that are unionized, and we anticipate in the bauxite sector to have something, I think, in another week or so. And of course, and I want to just commend our workers, our leaders, trade union leaders, for coming on board and embracing the vaccination initiative. Of course, the private sector initiative, which has been led up to this point by Peter Meledo, and then expanded to include Gordon Shirley, they are working to see what else can be done to further expand the program. So it is a positive sign, and I believe it will get better. And so I want to continue to encourage Jamaicans to participate, get vaccinated. It remains the most effective response to COVID-19. So in closing, I want to again underscore the importance of adherence to the protocols, the mask wearing, the physical distancing, and of course to encourage all of us to get vaccinated. Those who are waiting on the second jab from Pfizer, as soon as we get word from the US, we will make you aware. And for those who are not yet vaccinated, there are 2 other brands that are available at a location near you. Thank you very much. Stephen.
Thank you very much, Minister. Just reminding our media colleagues on the Zoom to use the raised hand feature to pose your questions to the team. We'll begin with Althea Saunders from the Jamaica Observer.
Okay, good afternoon. I have some questions related to the expansion of vaccination sites. The minister, you mentioned that as early as the next week, you could engage private hospitals. Is it that you're hoping to reach an agreement by next week, or you're hoping for the rollout to begin? And how many proposals have you received so far for the RFQ?
Okay, I can't give you the number of proposals now, but by tomorrow, 11 o'clock, we can put something out on the numbers. As it relates to the private hospital, the reason I can comment on those with some amount of certainty is that we have been having meetings with them, meaning the team, the technical team. Inspections have been done of their facilities, right, Dr. Ennis? And Dr. Ennis can elaborate a little on that. And, they have been given the kind of technical guidance. So in a sense, they're already a work in progress. And a number of them I know would have expressed an interest in participating, having had the initial meeting, which I participated in. So the agreement is really going to be a function of how quickly they get up to speed on the additional requirements, if any, required, the technical stuff, whether storage capacity, whatever that is, and then, of course, on the pricing. And we have done our own internal estimates to have a sense of what would be a reasonable price that the government would pay for each vaccine delivered. Dr. Ennis, I don't know if you want to comment further on what I've said, but that's why we can speak with some certainty on that particular group.
Thank you so much, Minister. I believe that 2 of the private facilities are far advanced, and I do believe that by next week, midweek, we should be able to be rolling out in at least one of those facilities. But we continue our dialogue, and certainly by the end of September, our 6 hospitals should be up and running to vaccinate.
Very much. We're going to go to Kimon Francis from the Gleaner.
Afternoon. 2 questions. One from last week, I didn't get the answer for, and that's the number of children hospitalized with COVID. And the second is how much the government has spent so far in fighting the virus.
I'd have to ask the clinicians I don't know if they have the data on the children, and then the PS would have to deal with the costing issue.
We can provide you with more accurate information. I do recall that you had asked a question, and in our next COVID conversation, but from our very first preliminary check, it looks like probably just under 200 children would have been hospitalized since we started managing COVID March the 10th last year.
Thank you very much for the question. For us, in terms of the COVID spend, I will provide more details at the next COVID conversation. I will give the detailed spend for all the categories of payment for COVID. So we will give you that at the next press conference that we have.
Thank you very much, PS. We're going to go to Chanel Lemmy from the Star.
Good afternoon. My questions are for the Minister. Minister Tufton, the average COVID positivity rate for the last 7 days has been 39.8. What measures do you think will get that number back down to under 5%?
Are you sure I'm the one to ask that question? I can give you it's a serious issue, so I'm not trying to trivialize it at all. The fact is that the numbers have come down, the 7-day average, and the CMO can comment on it. So the key to addressing these issues when you use data to assess your progress is to look at trends, not just one data point at a particular point in time. And so we have every week given information on the reproductive rate, the positivity rate, hospitalization rate, and so on. And we run an average, a 7-day average, to see whether we're going in the wrong direction or the right direction. I can say that we're going in the right direction in terms of it coming down, which is a good sign, and which means that some of the measures and the responses to the measures are working. The pace of that is what obviously will become a point of discussion. You know, should we be somewhere else? What else can be done? And my basic thing would be, of course, the observing of the protocols, the mask wearing, the physical distancing, the vaccination program. Can't stress that enough. Very, very important, because that's what's going to reduce hospitalizations and minimize deaths. Maybe I shouldn't venture there, but I want to say that over time we're going to have to look at recognizing that COVID as a virus will be present in the population. And the variables of concern or greater concern are going to be hospitalization and deaths. And normally all the variables are linked. The more you have positivity, then the more you're likely to have hospitalization and deaths. But hospitalization and death overwhelming the health system is really what you're trying to minimize. And there's one thing that stands between greater levels of hospitalization or less hospitalization, even if you have high levels of COVID. And that is, to my mind, to date, vaccination. Because even in countries where you will see high levels of positivity with high levels of vaccination, the difference between them and other countries where you have low levels of vaccination and high levels of positivity is that you have high levels of hospitalization and higher levels of death. I hope I'm not confusing you, but the more we vaccinate, to put simply, is the less we're likely to end up in hospital, even if we catch the virus. And the less we're in hospital is the less likely we are to die as a people. And so vaccination is key to that process. CMO?
Right. I just want to say that we have to be concerned about the positivity rate, but the greatest concern is that we have a very high degree of correlation between our number of persons hospitalized and the number of persons that die. It moves in tandem with the positivity rate. So when you look at our charts that we normally put up, and you will see that the pattern is the same. And we really need to break that pattern. We need to break that pattern, and we should have broken that pattern, because right now, in this surge, we're still having a high number of persons that are hospitalized are the persons that are over 60, and the high number of the persons that are dying are the persons that are over 60. And we're also seeing, of concern, that we are seeing several of our healthcare workers that would have died as well. Now, from the 10th of March, we started to vaccinate. Our priorities were to get the over 60 and our healthcare workers vaccinated. And if it was that we were able to get those persons vaccinated, then, you know, this surge would not be so heartbreaking to many. So we have to break that correlation, as Minister said, where even if we see a positivity rate going up, then we don't see the hospitalizations going up and we don't see the deaths going up. And the answer to that is vaccination. If it is that you want to prevent the persons getting into hospital, you need to vaccinate. Vaccination, you still may get a mild illness, but you're going to not get a severe illness. 98% of our persons that are in hospitals are unvaccinated. They have not received either a first or a second dose. Almost, I think, 100% of our critically ill and or severely ill are unvaccinated. Now, that speaks a lot. So we have to get vaccinated so we can keep down the hospitalizations and the deaths and break that tie that we have between the positivity rate and the level of hospitalizations and deaths.
And my second question for the Minister, thank you for that, CMO, is what is the plan to reach those remote districts and communities that cannot currently benefit from the new expansion plan that you have just mentioned?
I think that the plan has commenced. We will have to intensify, but you would have heard the Prime Minister now on the road doing some of these public education, public encouragement campaigns, if you will. He has been in St. Thomas. He has been in parts of the corporate area. I have been also leading another team in Hanover. I was, Westmoreland, St. James. On Thursday, I believe he's in Manchester. I'll be in St. Elizabeth. And it will go on and on. And the purpose of these are to coordinate, well, to provide encouragement, to mobilize, give support to the mobilization program for communities, including rural communities, in collaboration with elected representatives, the members of parliament, the councillors, community leaders, working through the Ministry of Local Government and Rural Development, and the public health infrastructure in these parishes, where we set up additional sites in some of these communities, in these areas, and working with the leadership on the ground, mobilize persons around getting vaccinated in these locations. So I'll give you an example. I was up in Cambridge, for example, which is in South St. James, with the Member of Parliament, MP and Minister Homer Davis, where the health centers in that area were operationalized with vaccines. And we went in, we encouraged and worked with a team on the ground to mobilize. I believe the opposition leader, Mark Golding, was in his community doing some of that last week and benefiting from, hopefully the community benefiting from his leadership in his constituency. And I could go on and on. I just drew on those two examples. So you will see more of that taking place with the mobile units, which we have tested and demonstrated to be effective or to play its own role. You will see more of that being done with the RFQ completion, which means hiring private entities who meet the requirements to go into these communities, and they will, in some instances, create their own mobile infrastructure, mobile units, and administer. You will see some of that taking place through private entities, through the private sector initiative. As we have seen recently, Jamaica Broilers had an execution in Central Village, where they not only provided an opportunity for their staff members and their families to be vaccinated. Their substantial offices located in that community, but they also opened up their vaccination blitz, if you will, to members living in the community as part of their corporate social responsibility. And that is a very good thing, and we are encouraging others to do the same. So the answer to your question is multifaceted. There are several channels that are now being operationalized, and the intention is to further expand those to get into those communities. This is now separate and apart from when we used to bus people from the communities to a central site, normally in the town square. The idea now is to take the vaccination blitz into those communities. And I think it will get better with time. We will still have some hesitancy, I'm sure. I've certainly experienced some of it in my travels in some of these communities. Some quite hostile and aggressive, others not so. Some curiosity, some people just wanting to be satisfied around the safety and the efficacy of the vaccines. So you have to spend time to overcome. Everybody has an opinion, and everybody is entitled to their opinion. It is our responsibility to try to address those issues and concerns, and that's what the community activation is, and that's why we need all hands on deck. And so we're working towards that. Thank you.
Thank you very much, Minister. We're going to go to Dion Jackson Miller from the RGR Gleaning Communications Group.
Hello. Hi. Thank you so much. A couple of quick questions. One, in relation to the stats, right? So the minister cites, as we know, deaths, cases, recoveries. We haven't been hearing anything from the ministry about long COVID. I may have asked this before. Is the ministry tracking what is happening with the people who have quote unquote recovered, but who in many cases or in some cases go on to have serious problems involving heart, hypertension, all kinds of other things? That's one. Number two, the Delta variant has changed the whole conversation around herd immunity. Some experts now, like the head of the Oxford Vaccine Group, are saying the concept of herd immunity is now mythical in relation to COVID. What is the ministry now working with? What's your theory right now in terms of herd immunity, and how long do you think it will take us to get there given our current vaccination rate? And finally, any comment on reports of chaos at multiple vaccine sites today? Thank you.
I'm going to be happily allow the clinicians to take on those questions, Dion.
Hi. Okay. I'm sorry. I must have missed that first question that you had posed some time ago about long COVID, because I certainly would have prepared a response. but I don't have a response now. We are tracking and we are monitoring our patients, but we can look at providing a report on that. Thursday may be a little bit too soon though, so I would say for next week, so a report on long COVID. In terms of herd immunity, that question has been asked before, where it is that we stand now. Certainly we know that when we started out with the original strain of the SARS coronavirus 2, based on the reproductive number at that time, then the level that of population vaccinated was estimated to be somewhere about 65%. Since then, we have had several strains, and we are seeing, of course, that among persons that are vaccinated, we're getting reinfections, and we are seeing where you have countries that are over 70% vaccinated, that you're still having outbreaks and surges. So clearly there has to be a shift in how we look at it, and I don't think that we can really give a number at this time based on the fact that we are responding to several different variants. So I don't think it would be safe at this time to give any estimation, and I think every country around the world now is trying to look at how do we get as much of our population as possible vaccinated.
Just comment on the other question. You had finished the technical stuff, right? The chaos question, Leon, in your true frank and upfront style, which I admire, by the way. One has to apply some context to what is deemed chaos at some of these vaccine sites, and I think it's, none of us, certainly the government, certainly the Ministry of Health, wants persons to go to these locations and to wait for extended periods, or worse, to wait in a context of discomfort. It's not our desire, it's not what we promote, it's not what we encourage. Having said that, there are variables sometimes that are in our control, and there are variables that are not in our control, and there are variables that we adjust as we go along as the process evolves. And the evolution of that process is a function of the perceptions around vaccine and the take-up, because things change, people get convinced for whatever reason, hospitalization, death of a loved one, the availability of vaccines and certain types, preference for brands and so on, and the adherence to, or the lack thereof, to the system that are put in place to ensure that there is a more orderly administration of the process. So having said all of that, to put it in an example form, if we say there is a toll-free line and there is a website for getting a time for your appointment, and only 30% of those persons turn up having followed that process, the other 70 turn up randomly, you're going to have some chaos, because it's very difficult to plan. And if you take a decision that you're not turning anybody away because there is, it just doesn't look good, you're condemned on that too, because you're said to be refusing to administer people even though they didn't make an appointment. Then what you end up with in trying to accommodate all is another change in the variable, and your ability now to make adjustment means some amount of inconvenience and some amount of wait. Having said all of that, it is very encouraging that more persons are taking up the vaccines. It is a need, it creates a need for an expansion of the outlets to administer, which is exactly why we are doing what we're doing, where we're adding the hospitals, where we're doing the RFQ, where the private sector initiative is on board to add additional capacity because the existing capacity has limitations. And I think that is playing out in a manner that will see us achieving the targets that we set for ourselves. So, while I agree with you, and I am, apologetic to those who have had to suffer inconveniences in terms of wait. The truth is that the process is not perfect, and that imperfection is not always the responsibility, if you will, the burden of those who are establishing that process. Sometimes it is just how we as Jamaicans approach accessing the opportunity to get vaccinated. And I put it no stronger than that, because I don't want anyone to misinterpret what I'm saying. It does take, however, both the health team and its stakeholders and the people to collaborate to make the process, to maximize the efficiency of the process. The final point I'd say is that I am told that on average, the vaccination process in most countries throughout the world, except when they hit the hesitancy period, and I don't think we're there yet, is normally about 2 hours. And while it is true that some people wait 3 or more, there are some people who have gotten through in half an hour or an hour. So it would be interesting to determine a time and motion and the locations to determine exactly what the average wait is. But if you go there with an expectation of getting through immediately as you arrive, then you're going to be disappointed. You must budget some time, and the average time is about 2 hours. Thank you.
We're going to go to Giovanni Dennis from TVJ.
Thank you so much, Stephen. So my 2 questions to the minister. One, what's the status of the internal investigation into how many people died from the oxygen shortage recently? And will there be an independent investigation into that issue? 2, the government has now had to stop giving the first dose of the Pfizer. Given that Pfizer is the only vaccine that children can take, and yet so many are not vaccinated, are yet to get vaccinated, did you start giving adults this vaccine too early?
All right, so let me answer the last question, since it's a policy decision, and allow the CMO to gather her thoughts on the oxygen issue. She has spoken to it before, I think last Thursday, and she did say it was an ongoing process, and that she had a particular conclusion. I'll allow her to comment. When the Pfizer vaccine date was, when the agreement was reached around 600,000 doses to be given in tranches, there was a understanding that we would have received a first tranche the time when we did, and then a second by in and around mid-September, and then the third after. And it is based on that information that plans were made to use that vaccine or that brand to inoculate children as a priority, and we did say so publicly. But not just children. We did say that if a parent or parents took their children and the staff of the educational institutions, the teachers, auxiliary, all the staff members, administrative staff, wanted to access the vaccine and came to the location, they would also be entitled to take that vaccine. And so the policy was to prioritize that group in anticipation that the next tranche would have arrived in time to continue administering, and in this instance, to second doses. Well, you've heard the challenge that we face. So this is what has created now the need for this particular announcement. But I think it's important to note that this is not a reflection of a waste of time for persons who have taken their first dose. They are still protected to the extent that they have the first, and they still have some time to wait in order to benefit fully by getting the second. And all we're asking for them to do is to be patient, not to worry too much or panic. We're not there yet, and we're hoping not to get there, and just continue to observe the protocols until the second shipment is known and arrives. The CMO can comment on the oxygen issue, given that it's a technical issue in terms of deaths or in the system. CMO.
Right. So last week, Thursday, we had said that we continue to collect the information on the deaths so that we can be able to give more of a better estimation of how many persons may have demise as a result of low oxygen supplies, if any at all. And we still continue to collect that information. We do consider it an important investigation that we are undergoing, and so we are giving it attention. And as soon as we have the information available, we will provide it to the public.
CMO, we have two questions from Maisha Browdy from RFM. She's asking, why are we seeing a delay in the reporting of deaths? And is there some delay in test results? Some persons have stated that they have done tests, but days or even a week later, they still have not received the results. What is the cause of this?
In terms of the reporting of the COVID deaths, we do get them reported sometimes days later. And then when we get sometimes the reports, then the cases need to be investigated. So we may get a death reported, but we don't have enough information to be able to classify the death as to whether it is a COVID death or it is a coincidental death, meaning that the person died of some other reason, but coincidentally has a COVID positive test. So it does take a little time sometimes to get that investigation done. And you would recall and you would see that sometimes when we report the deaths that we say that they have occurred over a period and not necessarily just the day before. So it's really just a matter of collecting the information, making sure all the information is there to be able to give an accurate interpretation of that information. And also it is also dependent on the reporting at the local level, which sometimes does not happen on the same day, but may take a few days to come in. I am not at this present time aware that we're having more than the 48-hour turnaround time in terms of test results in the public sector. But now that you have bring it to attention, we will investigate. I have not had the reports, so we'll investigate and find out if there is any new problem. But certainly we have enough kits, enough tests in supply, so we don't have a supply problem. So we will find out, of course, from time to time if there is a lot. Sometimes there are human resources issues, and it is, the same staff that is doing a lot of things. So there may be other reasons for delay. I'll investigate.
Can I think the question about this, the independent inquiry into the oxygen issue. I've seen and I've heard the calls being made. I want to share a perspective that I have on that. My approach to these issues is that when there is an outlier event, a disruptive event, an event that has had consequences, and we need to apply some assessment of that event, it is important to allow the internal mechanisms and structures of any institution to work to determine why we have had such an incident, what are the causes, and what are the corrective measures, which includes whether or not there is any liability of any cause on the institution and how it functions. And we call for these independent inquiries, and I suspect it's a function of how we view the system and perhaps even a lack of confidence in the system to perform. And it does create an impression when things happen and those explanations that are given are not accepted because of that credibility issue. And it's something we need to fix as government and as organizations, and in this instance as a health ministry that is charged with the responsibility to secure lives for the vast majority of the population. But I do believe that in referencing or referring a case for independent investigation every time there is a mishap, as an institution, we're also further undermining the capacity of the institution to solve the problems that it has. And while I agree that we will always have room for improvement, and there will come a time, or may come a time, when that independent assessment is necessary for public perception and management, and also to generally improve the process. We also should give the internal mechanisms an opportunity to work. And I think in this case, that is what should be allowed, and I say so as a lead policymaker for the ministry. The case of oxygen and its short supply and the likely impact, there are some known truths around that particular scenario. Despite the noise that is out there around who is responsible, the fact is that there is a shortage, a global shortage. There is local capacity provided by a supplier. That local capacity was exhausted. In other words, they produced all that they could and continued to produce, but the demands on the system exceeded what the capacity could provide. There was no breakdown in that infrastructure. They provided what they could, given their capacity. The difference had to be made up by imports. And it was always known that there would have been a difference given the surge plan that we had. In this instance, the import that was arranged failed to arrive because of demands in that source market, and indeed in several other source markets. So in a sense, the cause of the shortage is a function of the surge and of the inability to import. And we can argue over who is responsible there, but there's no doubt that there were efforts to bring in the additional capacity. Now, how did the hospital system respond to that? The institutions, coordinated by the regional authorities, spent a very long time, consistently so, trying to juggle, for want of a better word, the existing supplies back and forth from the supply source. As they produced, they took right through the night and day, moving around portable cylinders to give support to patients who are most in need. And that went on for the 2 or 3 days where we had the shortfall. And frankly speaking, as a consequence, I believe lives were saved because of that adjustment to a crisis context that was created by not being able to import. Now, I do agree that we must determine if persons have died because they could have been saved if they had oxygen. The CMO has spoken to that last week and indicated that the discussions, the investigations are ongoing, but up to the point when she spoke, she had no indications of that. I would like to see that process concluded before we jump to conclusions and call for an independent investigation on a matter that, to my mind, the internal structures can or should be allowed to attempt a solution on. And so I am relatively comfortable, despite all the issues and challenges, that the system responded the best way it could. And yes, we should learn lessons from it. Yes, we have to take measures to improve. I know the PS has had meetings with the supplier since that time, and we have had a long set of dialogue around how to prevent this from occurring again. But I really do not think, in my best judgment, and I'm fallible, but in my best judgment, that the system did not do it the best it could to respond to a crisis situation in the context of circumstances that were outside of their control. Thank you.
Thank you very much, Minister. Damien Mitchell from the Cleaner is asking, at what point will the government explicitly restrict gathering for entertainment activities in hotels? At what point will the government explicitly restrict gathering for entertainment activities in hotels?
Well, you're making some assumptions, and you normally do that, Damien. You ask questions based on assumptions that I can't say that I share in its totality anyway. The truth is that the hotel space is guided by protocols, and those protocols are in effect, and those protocols address issues around sanitation, mask wearing, sanitizing, testing. The hotels spend a lot of money on testing to ensure that they control the virus, or at least track or provide appropriate surveillance, firm level surveillance around the virus. They also do the same in terms of the resilient corridor, which you'd have seen some data put out by them, spoken by the Minister of Tourism on. And so if the question is suggesting that they are not doing enough, then I would take some issue with that, in that we know, and it is subject to inspection, and we do inspections, that they do have a protocol that they comply with. And further to that, I know that they are now embarking on a major vaccination program to vaccinate their employees, their families, and hopefully the communities around them. So, that's my response. I think they're trying to do what they can. Always room for improvement, and we will continue to work with them to further improve as the need arises.
Thank you very much. We go to Cassius Watson from Jamaica Social.
Hi, good afternoon. Good evening almost. I have three questions. One on debts. And this goes to the CMO. Are you seeing more and more people passing away at home? I mean, there have been stories in the media of funeral homes actually now having to collect remains at home. And so people are now dying at home more frequently than in hospital exclusively. Are those people who died, are their deaths investigated? Or are they part of that investigative process that we see on the reports that are given to us daily, and kind of give us a clear idea of how that is kind of done, as simple as you can make it? That's one question. My other question is to Dr. Ennis. What percentage of persons 60 and over are now vaccinated, as far as your records show? And my third question goes to the Permanent Secretary, Mr. Bryan. Why is a TRN required as well as identification when it comes to vaccination? What's the thinking behind that? Because many people have asked me this question. Why is it that the government would want to collect your TRN for vaccination? Why isn't ID enough? And that's it. Thanks, guys.
In terms of the overall overall increase in the number of persons dying at home, we don't have that report. Normally when persons die at home, they will go straight to a funeral home if it is that the doctor who is in charge of their management can be reasonably satisfied as to the cause of death and is able to give a death certificate. If there is any question as to how the person would have died, then it becomes a case for investigation. So many persons who die at home are actually taken to hospital, and they are pronounced there, and so they would be classified as a brought in dead or dead on arrival. And at that time, a history is taken so that we would have had a few cases that would have been classified as COVID cases that were brought in dead, because the history that was taken would have suggested that this person would have died from COVID and may have had a positive COVID test, and the symptoms suggestive that they would have died as a result of that disease. So we do capture that information, but in terms of having a report to say that there is an overall increase in the number, those numbers are very, very small, and we have in the past at the press briefs presented how many persons have been brought in dead, and we can get an update on that information so that we can share in our press conference.
With regards to the percentage of the elderly that have been vaccinated, if we break it down in two groups, persons over the age of 75, we are at about 19%. And when we add those 60 and over to that group, we are closer to 25% of that population. We should be reminded that this population remains the most vulnerable group of persons for having severe illness, hospitalization, and death. And although the vaccination program is now open to all persons over the age of 18, and for Pfizer, those over the age of 12, we are still focusing on this population of persons 60 years and older, and certainly asking everyone to bring out those persons 75 and over, because we are at a bare 19% in that group, and 23 to 25% for all elderly persons.
So in terms of the identification, so the identification that is required at all vaccination sites are your national IDs, your passport, your driver's license. In the case of children, it's their birth certificate, just as a proof of age, not necessarily as an identification. Now, we ask for TRN not as a required documentation, but it is a good way of unique identification, as best as unique in terms of our current available mechanisms for tracking and getting information in terms of persons' identity. So the TRN is not a required field. For those persons who have no form of national ID, they can come to the vaccination site with a letter from a justice of the peace. There have been statements on social media about children who have been asked for IDs. Children under the age of 18 are not asked for an ID. They just need to have a birth certificate as a proof of age, because we want to make sure that we're administering the vaccine to children 12 years and above. And they should also travel with their parent or guardian so that consent can be provided at the point of vaccination.
Much space. Just have a follow-up from Dion Jackson Miller.
Hello, thank you so much. Yes, I'm here. I'm here. First of all, a follow-up on the issue of the Pfizer vaccine, trying to understand the ministry's thinking on this. All the vaccine shipments have been running late, all of them, for months. So why would the ministry have put its pot on the fire for a vaccine shipment that hadn't come here yet, and then you end up in this kind of scenario? Really trying to understand the planning process that took place there. Secondly, going back to the issue of the oxygen, the minister said he sees no need for an independent investigation, given the fact that the internal processes are at place. Just to repeat what our newsroom has reported before, we've had multiple sources across the island tell us that patients died that weekend because of the oxygen shortage, and fear of a cover-up is real. That's why people are asking for an independent investigation, Minister, in the interest of transparency and to indicate that there is no cover-up. So are you not willing to reconsider that issue? And finally, the PS said just now that parents are supposed to go with children to provide consent, but I've had several complaints about parents being separated from children when they get to the vaccine site. Surely this should not be so.
Okay, let me take an approach to the two, and then I don't know if the PS has a comment on the parent issue. The unpredictable nature of arrivals of vaccine, it is true. It has been a major challenge for us since we first started to get shipment, for the reasons that both you and I believe the country, for the most part, is aware of. In this instance, the vaccines that we receive, the Pfizer vaccine, with a commitment for an additional shipment at that time that I had announced, represented a slightly different perspective, because there wasn't a view that, certainly from the source country, that these vaccines were in short supply. If you look at the challenge around COVAX, for example, a lot of the supply shortfalls were linked to just not being able to get from the manufacturer. And so there was some amount of greater certainty, put it that way. In addition to that, however, there is a view that, or certainly our clinicians subscribe to, and we take advice from the technical people, that it is better for someone to have a single of 2 doses, particularly in the context of community spread, than not to have a dose at all, because we are reserving it to give a second jab to someone who has had the first. In other words, we provide greater protection to the populace by administering what we have, and particularly in the context of the commitment to deliver within a reasonable time, rather than to hold, let's say, 100 or 1,000, half of that, and then administer to those who would have had a first jab, and thereby denying others who could have. And the final point on that is that the assumption that somehow persons are in jeopardy is not a correct assumption. Yes, we did say we would do a 3-week turnaround, but as I said earlier, based on the WHO guidance, persons do have additional time and continue to benefit from the single until the next is applied. So the 6-week is reasonable and technically sound based on WHO, and indeed some have gone as far as 12 weeks. So I don't want this to be interpreted or positioned as somehow a disadvantage, but it is true that expectations were given based on the pronouncements made. And of course, we think it's important to provide clarity and reassurance in this instance. The other quick question around the oxygen and the need for an independent inquiry. I'm not saying that in these things one should not be open to independent inquiries. And I'm not even saying that in the case of this instance. What I said, and it's important to appreciate what I'm saying, is that we need to allow the internal processes to work. This idea of calling for an inquiry and just jumping over the internal processes, certainly it's hardly ever done in some spaces. I mean, you have a structure, and the structure should be given an opportunity to work. Now, if the structure doesn't work, then I fully appreciate that we need to improve on that, and it may be at that point that you need to have a more independent assessment. But I don't subscribe to the view that we should seek external help so frequently that we end up undermining the structures that we establish. Improve them where we must, but give them a chance to work. And in this instance, as I said, the issues leading up to where we are quite clear and transparent as it relates to oxygen and the availability of it. And so it's not like we're trying to hide something. Those have been made public. We've provided evidence of it in many cases in terms of the supplier not getting the overseas supplies that they wanted to or they ordered. And if they got it, we would not have had this issue. And then finally, on the people expressing their views about people dying and so on, you know, if we went by what people say on these matters, we'll be carrying the donkey to market, because I tell you, I've you know, a lot of these things we have to verify and validate, and people say all sorts of things for all sorts of reasons. I have to depend on the process and the clinical team to assess by getting the reports, and those reports are what inform my own position and how I influence the decision-making process. I cannot depend on hearsay, rumors, and innuendos to determine policy, because if I did that, then I wouldn't be providing leadership. I'd be allowing everybody else to lead me. And I don't see that as the role that I have once I'm in this position. Thank you.
So the issue of the separation of children from their parents, that is clearly not the standard operating procedure at any vaccination site that has to deal with children. I do know of an instance at a particular site where parents were being told, because of the size of the crowd, that they were separating children. And when we were alerted to this, we advised that this had to be stopped immediately. And it was corrected. But this was based on a particular element of the management of the vaccination center, trying to crowd control. But we had to explain that you can't take away the right of the parent in trying to administer the crowd at the vaccination site. So at this point in time, we are clearly indicating that once we are vaccinating children, the parent or guardian is to be there to provide consent.
Okay.
The CMO wants to comment on this issue with the oxygen.
Yes, I really feel the need to comment, because I'm a little bit taken aback by the consideration that we're trying to hide deaths. You know, the Jamaican health system does have a capacity, and from we started to manage the COVID pandemic, we have made it very clear that there was a capacity that if we did not keep the numbers below the capacity of the health system to manage, that we would have dire consequences. Over time, we have increased that capacity. We have increased the number of beds, we have increased the number of staff, we've worked tirelessly to secure personal protective equipment, training of staff, to provide more oxygen supplies. But the fact is that, you know, there is just so much that within our context that we can provide, because there are always limitations that prevent us from going above a certain level. And the fact is, if we go into a fourth surge and we remain with this much of our population unvaccinated, then the threat becomes real again, that we challenge we challenged the limitations of our capacity. And, you know, on August the 27th, 28th, the health system was faced with a crisis that we ran low oxygen supplies in our hospitals. And the health team worked tirelessly to try to reduce the impact of this on our patients. And we were able to save a lot of persons. Now, there are persons that died over that period of time, and right now, so far, we're unable to say, was it directly as a result of the low oxygen supply, or was it a natural progression of their illness? And we have made a commitment that we are working on those details to try to find out. But, you know, the thought that we are hiding deaths really should not be entertained by the Jamaican public, because I think that we have been very, very transparent in what it is that we do and how it is that we have been trying to manage this crisis. And at times of challenges and crises that, you know, we don't know how long this pandemic is going to last, and things may look good now because positivity rate is coming down and we're trending in a certain way, but then you don't know what's going to happen over the next couple of months. So when these challenges and crises come, I want the Jamaican public to understand that the health system, every member and team in the health system works to try to prevent the bad impact on our population, and we work tirelessly to do so.
Thank you very much, CMO. Our final question is coming from Emma Lewis.
Yes, good evening, everyone. One question I'd like to ask is, we've sort of touched on it a little bit, is do you believe that the series of no movement days has had a direct impact on the number of COVID cases in any way, or the number of deaths, come to that? And secondly, regarding senior citizens, I was reading an article about a gentleman in a rather deep rural area who wasn't able to get to a vaccination site because he, you know, has some disabilities, but really wanted to get vaccinated. And again, I wonder, are you making the greatest possible efforts to reach senior citizens, especially those who are sort of stuck at home or in a rural setting, especially? Thank you.
Yes, well, we certainly believe that the no movement days have had an impact. We recognize that, you know, during the days that persons move, that there is increased congestion, and certainly we would want to see that cut down. But the no movement days does reduce some movement, the percentage of movement that we would have over an entire week period. Then you would have decreased movement and therefore decreased opportunity for exposure and spread. But then also there is the important messaging to persons, you know, in terms of the seriousness of where we are. Unfortunately, our population tend to relax very, very quickly. And when they see the restrictions reducing, they seem to take it as a license that everything is well. And sometimes it is important that you have to make big moves in order to be noticed, and so that persons will pay attention and recognize that, hello, our positivity rate went up to 50% and over 50%, and you really have to do something to cut down the level of exposure in the country. So certainly there has been an impact of the no movement days, and the restrictions have had positive impact in getting our numbers down. What we would really want to see is that instead of having to impose national restrictions, that persons would take this personally and impose on themselves that personal restrictions and those personal measures that would prevent exposure and spread. Not because there's a party you have to go to it, and not because you can go into a crowded taxi you have to do it. You know, people have to take responsibility and recognize that it is their actions. It is their actions that are taking us where we are in terms of these high positivity rates, and they really just need to stop. And don't let it have to be that we have to impose national restrictions to do so. It is time for us to all take that personal responsibility.
Regards to persons with disabilities and the elderly population that may not be coming out, we have started to vaccinate these persons. We have encouraged their relatives, if possible, to allow them to partake in the drive-through facilities that we have been operating, certainly in one site since the beginning of our vaccination program, and in another since midway into our program. There is the need to increase this service, and we do believe that now that we have our mobile buses in operation, we will be able to go into areas where these persons are located. We have partnered as well with the Senior Citizens Associations, the Council for Persons with Disabilities, to bring out those persons, and we certainly will be having dedicated days for persons who can come into our centers. So the focus is certainly on these persons. We are not leaving them behind at all, and we are offering them the suite of vaccines that we have.
Thank you very much, Dr. Ennis. So, Minister, just in your closing remarks, could you comment on any update on the field hospital at UWI, and then you can give your closing remarks. Thanks.
Okay, so the University Hospital of the West Indies continues to put in the base infrastructure for the field hospital. In fact, I got a picture looking at late this evening on the progress that they're making, and it seems to be making good progress. I was told that it would take another 2 or 3 weeks to have it up and functional. So that would add some capacity to that institution, which is good because they have been taking on quite a number of COVID patients and have had to convert their other functions into COVID functions and COVID wards. I should mention that tomorrow, is it tomorrow or Thursday? Thursday, tomorrow I am opening the Maypen Field Hospital. I'll be traveling to that parish to officially commission, if you will, that facility. And that's a positive thing because that parish requires additional support, and that is now completed. And I'm sure you'll hear and see that. The SAV facility is being worked on as we speak, and so that one hopefully will be up in short order. I think, again, there's a 3-week or so turnaround for that. The base is the key, and then the facility is placed on top of that. And then the others are also being worked on. I think Mandeville and St. Anne's Bay. Mandeville. So all told, we have St. Joseph's, Falmouth, and Spanish Town. Tomorrow, Maypen will be commissioned. UWI is a full throttle, work in progress, and so is SAV in Westmoreland, and Mandeville to come. And that will increase our capacity and therefore help us to overcome the current surge that we have and hopefully any other possible increased demand in the future. In closing, I want to thank those online, those who have listened, questions that have been put forward, the team who are here and others who have given support, the members of the team in the field, supported by stakeholders. I am encouraged despite the challenges that we have been facing. We've been to a rough period over the last 2 weeks, but I want to reassure the public that progress is being made. Tomorrow, the Prime Minister will address the Parliament, and I'm sure he will have more to say on the measures. We've had our internal deliberations at the level of COVID subcommittee and the Cabinet, and the Honourable Prime Minister will speak to those specifics in the Parliament tomorrow. So please tune in, and of course we'll address the, going forward in terms of, restrictions or all the other measures. From our perspective in public health, we are happy encouraged to see that we are inching closer to the target of 700,000 doses up to the end of September. We are 98% of that target. That's a good thing. We're happy to see more persons coming out, even some of the crowding that is taking place, encouraging signs. Happy to see other outlets being established, the mobile units, the RFQ for private providers, which will be on stream, the private hospitals, the community activation blitz headed by the Honourable Prime Minister, myself, going through the communities, working with MPs, with the Ministry of Local Government and Community Development. The consistency of vaccine supplies, despite the challenges with Pfizer, one brand, we are now seeing certainly AstraZeneca, Johnson & Johnson coming in. We have enough stock, and we encourage Jamaicans who are not yet vaccinated to take up those brands. They are as effective as any other. And that is also encouraging. The challenge is no longer a lack of supplies. The challenge is getting it into the arms of people. And the strategy is evolving. And finally, the contribution support of the private sector, private companies that are coming on board, organizing their own blitz. I get offers daily about places or spaces that are being offered to be used. The health team is always visiting, inspecting, and collaborating. We have an amazing healthcare team, absolutely amazing. And we owe them a debt of gratitude every single day during this pandemic, because they have worked non-stop at great risk to themselves and their families. We've lost some of these persons on the front line, and we express condolences to their family members. We encourage those who are not vaccinated to get vaccinated. Many are, but some aren't. And it's something we need to recognize and confront, and really to push and to encourage, because it's important for their own protection, but also for just the message that it sends to the rest of the population. And to those who are still uncertain, the evidence becomes increasingly clear that it is through vaccination that we will avoid not necessarily contracting the virus, but certainly the risk of hospitalization and the risk of death. And that is the key to getting back to normal. Not to eliminate COVID, but to minimize hospitalizations and death. Thank you very much. Have a good evening.
Hello, Jamaica. I'm Dion Miller. It's unbelievable to me whenever I buck up somebody who is still asking if COVID-19 is real. Because my doctor died of COVID-19. I had COVID recently, and it was a severe case. Most of my lungs were affected. I am so grateful to be alive. Take COVID seriously, guys. Some people won't be affected, that's true, but others may have long-term effects, and some people will die. Let's do all we can to protect ourselves and to protect others.
A message endorsed by the Ministry of Health and Wellness.
Without a doubt, tourism is Jamaica's #1 industry, and our dedicated workers are its greatest asset. Jamaica would not be the heartbeat of the world without you.